Very good evening and welcome. You're watching the India Development Debate with me, Tamanna Inamdar, in news which may be termed as a path-breaking milestone for the health industry and really the world's fight against obesity. Novo Nordisk's obesity medication Wegovy has demonstrated its efficacy not only in substantial weight loss but has also shown a remarkable reduction in the risk of heart disease. This is a statement made by the pharmaceutical company, and the study says that the Dutch company's medication cuts the risk of cardiovascular events such as heart attack and stroke by 20%. Now, Novo Nordisk hasn't yet released the full trial results. These are trials conducted by them themselves, but the news has already taken the market by storm, surging the Danish company's shares by over 15%, which is Europe's second most valuable listed entity already. Now, if the study is accurate, it will ease the financial burden of patients. But the question is there enough information right now on drugs like this? It's not just Wegovy, it's Ozempic as well. A lot of these drugs have been hitting the headlines because of celebrities taking up these drugs and suddenly seeing a very dramatic change in their appearance. That has attracted a lot of attention. What's not clear though yet, that are these risk-free? What are the side effects or dangers of taking obesity medication if you're not a diabetic, or if you want to control or protect yourself against cardiovascular diseases? How far are we in India from taking up this kind of medication? Remember, the NHS in the UK in June has now approved this as part of their treatment for diabetes and obesity. Should we be doing that as well? So we're going to be talking about some of these aspects today on the show. And speaking on this is Dr. Aparna Govil Bhasker. She's a consultant bariatric and laparoscopic surgeon at Saifee Hospital. Mansi Gulati, a fitness coach, is with me on the show. And I'm also speaking with Dr. Rajiv Kovil, Chairperson at Zandra Healthcare. Welcome to all of you, and thank you so much for joining us on the India Development Debate. Dr. Govil, let me begin, with your take. Obviously, the fascination is there for a wonder drug which can solve this obesity problem. And as I understand it, what it essentially does is make you feel full, so you eat less. Is that a very simplistic way of putting it?
That is a very simplistic way of putting it in, but the drugs are very much needed. The disease is very, very, it's very severe, and obesity is one disease which has achieved pandemic proportions, and we yet do not have enough tools to tackle this obesity. So aside from the celebrity angle, I think there is a huge need for these kind of drugs in the world today.
Okay, let me come back to the basics, Dr. Aparna. What do these drugs do? How do they work? How do they make people seemingly very, very slim in just a matter of weeks?
Yes, so basically the whole, most of these drugs actually are GLP-1 receptor analogs, and GLP-1 is a gastrointestinal hormone. Put in a simple language, that these hormones are basically released from the small intestine, and they have a lot of effect on our satiety center, on our glucose control, on our weight regulation, and many other mechanisms. So what the drugs do is basically they would suppress appetite to some extent. They also lead to increased satiety, and they have a role in weight regulation and glucose regulation. So that is how they lead to weight loss. Of course, what we do with diet and lifestyle alone, it is much more with the drugs as compared to diet.
Okay, let me get a broader idea of why this has become such a rage. And Dr. Kovil, let me come to you on this. This is being described not just by investors in the Novo Nordisk stock, but by health practitioners also, at least in the Western world so far, as a wonder drug, as an answer to the battle, global battle against obesity. We're just leaving it to people's willpower is not enough. Tell me, is it truly a wonder drug, or are there side effects of this that we still don't know about?
I think before we go to the drug per se, we need to recognize that obesity is a disorder, one. Obesity causes almost 200 types of other disorders. It's the mother of all non-communicable disorders. there are 650 million people living with obesity in the world. In India, there are close to 150 million people living with obesity, and it has tripled in the last 3 decades. We are looking at almost 1,515 million people with obesity by 2030. So it's a huge problem and huge metabolic disorder. So one, if we have a drug which not only reduces weight, but also causes a change in outcomes, and outcomes which we are really concerned about heart attack, about cardiovascular death, about stroke, and it can improve our quality of life and improve survival. It's going to make a huge, meaningful impact in people's lives globally. And that's what Wegovy has done. It's not only shown that it can make people lose weight, but it can also cut down all the cardiovascular risk factors. It does it by reducing weight, reducing blood sugar, giving you lesser satiety and lesser food. It reduces your cholesterol, reduces your CRP, inflammatory markers, reduces your blood pressure. So it is a drug which acts on probably all these multi-metabolic problems that govern people with obesity and drives complications in people with obesity. So here you have, so in spite of there being so many celebrities, there is a huge, robust evidence behind semaglutide, which is Wegovy, and it not only reduces weight, but it prevents death, prevents heart attack, prevents stroke. That's why it's going to change a lot of prescription patterns across the globe.
So where are we on this in India? We seem to have consensus, at least from the doctors on this panel, that this is a good thing. There's nothing to be scared about. Now, two questions, and this is a follow-up to Dr. Kovil. Where are we in India as far as regulations are concerned? Is it available? Do you think it should be made available? Where are we on the process? And what about the reports that the moment you stop this, everything comes back? The hunger comes back, the weight gain comes back, clearly with that the obesity and the risk of cardiac events. So is this something you now do lifelong? Does it really work?
So obesity per se is going to be a combination of drug therapy, behavioral therapy, and lifestyle therapy. And it is going to drive diabetes, blood pressure, cholesterol, heart attacks. So if we are going to treat the main cause of all these other non-communicable disorders, it will make a huge impact. And pharmacotherapy, that means drug treatment for diabetes, is lifelong, for cholesterol is lifelong, for blood pressure is lifelong. So why can't the pharmacotherapy or drug treatment for obesity also be lifelong? Because it is the mother of all these disorders. So number one is that. Number two is that in India, till today, obesity is treated as a cosmetic issue rather than a medical disorder. It's time all the health authorities, associations, doctor associations, healthcare, everybody involved in this whole chain come together and recognize obesity as a disorder, as a medical issue, which drives complications and which is one of the largest causes of death world over, with almost 2.8 million deaths occurring in India every year. So there needs to be a huge consensus among the whole loop of people who are concerned about non-communicable disorders in India. And drug therapy for obesity will also be for lifelong. We have the oral preparation of semaglutide available in India. The injectable preparation has been approved by the Indian authority, which is DCGI, but it's still not marketed, probably because of the supply chain issues. But I think within a year, probably it should be there in India.
Okay. Now let's come to affordability and sustainability. I want to get the, fitness professionals' view on this. Mansi Gulati, if people find this quote-unquote shortcut to lose weight, will they stop trying to take the path of fitness? I mean, I'm actually going to come to Dr. Govil also for that. The bariatric surgeries might just become redundant, won't they? But first, Mansi.
Honestly speaking, why we need to go for all this artificial treatment, drugs and all? We all know that they have huge side effects. Why can't we simply go with the yoga? Because yoga is for healthy living. Honestly, my weight is from last more than 18 years. It is just 50 kg. I'm following yoga every day because yoga is for everything. We all know that it is for the perfect living. And also with the diet, with the exercises, if we can follow, so of course, we need to follow a diet. If after 5, we can stop eating oily food, junk food, and if we can take water also, because your body is more than 72% is water only, every half an hour, half glass of water. So my question and my request to
Ek minute,
all of you, why
Mansi
we
ji,
need to
just
go for
I'm just going to interrupt you there. And congratulations on having the same weight for the last 18 years. But you know, if it was that easy, if people had willpower, we wouldn't be looking at a global obesity pandemic. This is exactly the approach where you're blaming people, their lack of self-control for what we are seeing around us. Don't you think that we've gone beyond the stage of blame game now? If people
Absolutely.
everyone could do yoga, drink lots of water and maintain their weight, they would have done it.
Absolutely. See, I'm not blaming anyone. I'm just saying yoga make us emotionally stable. Yoga make us mentally strong. Yoga make us physically fit. Then why we need to go for all this thing? Of course, I understand. मैं तो आप सबसे, I'm just requesting you all. If you can follow, जो हो गया, we cannot change that. But if you can follow a healthy lifestyle, we don't need to go for any artificial and other things.
You know, I don't know. I've seen a lot of people who don't seem like they're in the right BMI doing yoga as well. So I don't know if that's really the solution, if it's as simple as that.
I'm the real example. I'm sitting in front of
No,
you.
I'm sure, ma'am. I'm sure you're, an amazingly fit person. We're looking at something on a very, very big range. Dr. Govil, and this, I think, comes down to the crux of it. Where, as a society, we tend to look at obesity as a cosmetic issue and something for which the patient is to blame.
So I think this is the first step. First of all, we need to look at obesity as a disease, just like we look at diabetes, hypertension, high cholesterol, heart disease, and so many other chronic conditions. Not everything can be treated with yoga or lifestyle modification alone, as the severity of the disease increases, which is different for each and every person. And that is how the therapies have to be escalated. You understand? So there is no point in blaming a patient for a condition that they are suffering from. That is, I think, that comes from basically not being able to understand the disease properly. So this first step is to understand that obesity is a disease just like any other, and it deserves to be treated. The whole concept that it is something which is self-implicated, which is coming out of lack of willpower, and so on, that is, I think that is very wrong. And as doctors, as healthcare workers, first step is to be non-judgmental and to understand that this is a disease like any other and it deserves to be treated. So that is the first thing that I would like to say.
Question I sort of asked in terms of a line of treatment, would treatments like bariatric surgery then get pushed down in your line of attack? Because if you have something non-surgical and if this helps, can you just understand how this changes the medical viewpoint to treating obesity and all of the diseases which come with it?
With a very, very positive outlook. Even as bariatric surgeons, I think we are the people who deal with patients with obesity on a day in and day out basis. We see that, and we see how helpless they are and what is the kind of the misconceptions that everybody has around them, and everybody pushes them to go through something natural and so on. So I think I look at medical therapy as an adjuvant to bariatric surgery. Like I said, that there is a very huge need for grading and staging the disease. A person who is 75 kgs is not the same as a person who is 150 kgs or 200 kgs of weight. So that means that this disease severity is different for everyone. Whatever stage of disease a person is at, the treatment should be according to that. And the disease is so complex that we may need a combination of therapies for many patients. And it is just going to be something like the management of cancer. where you have surgery, you have chemotherapy, you have radiation therapy, and you go all out to help the patient, basically. So, of course, we will need to relook at our guidelines. We will need to accommodate all these newer therapies which are coming in. But it's a great thing for our patients to, and for us as well, to have more tools to be able to tackle obesity.
The other sort of concern, and I'll come to Dr. Kovil on this, is the costs. This is a new medication. It's very, very expensive right now. Till I suppose you have Indian companies or Indian pharma also making versions of it, this is not something that everyone will be able to afford. And what are your views on that? Is this something that should be made a part of public healthcare policy?
I think it would be wonderful if this kind of drugs come in case of public healthcare policy, because obesity till today is a stigma. There's no empathy counseling for obesity. And if therapy can come as a part and parcel of public healthcare policy, it would be wonderful. Importantly, these drugs change outcome. They not only reduce people's weight, I would say it would reduce the weight of the nation. There would be a huge improvement in our GDP also if this happens. The productivity of each and every individual will go up if they lose weight by 5 to 10%. And I think policies need to be built around it. Nutrition need to be taught in schools. Physical therapy need to be taught in schools. Encouragement should be given for people who spend on themselves for their weight loss, or for their tax incentives for people who lose weight, or promotions for people who lose weight. I think the whole environment needs to change. And once that changes, the health of the nation will change.
In terms of this becoming commonplace in India, Dr. Govil, what is the sort of timeline you see?
So I think.
Okay,
I'm sorry,
Dr. Govil. That was for Dr. Govil. Yes, Dr.
Right.
Aparna Govil. Yes.
Yes. So the drug is at least a year away from coming into the Indian markets. And once it is here, and I think depending on what cost we get it at, it will depend on, that will basically indicate what kind of uptake it will have in our country, because it is expensive, there is no doubt about that. But if we see the overall compounding effect of the drug, it is going to save a lot more money, which would actually be spent on all the other complications of obesity if they were to happen. So we don't know as yet how much would be the uptake, but yes, we are all looking very, very forward to it.
I'll leave you with the last word, and absolutely physical activity, yoga, meditation, all of that is important. But do you think this could be something used in addition to medical treatments now, if they are proven safe by our own authorities, our own regulatory system?
So
Mansi Gulati, that question's for Mansi Gulati. Yeah.
Okay, my answer is very simple. Yoga se hi sab hoga. So please, I will request you, all of you, yes, already the side effect we all know, but it is better to go with the natural thing. So follow yoga and follow a healthy lifestyle. And if your doctor advice, then of course you can you can take drugs, but with the help of course, guidance of your doctor, and also do follow proper exercises. So everything is important, but you need to take proper guidance. And my answer is only yoga se hi sab hoga. Thank you.
We are looking at obesity as an economic issue, as a health issue, as something which is really impacting not just the productivity, but number of lives. And we'll have to go into a much more detailed conversation on its many reasons. Is it easy availability of junk food, more sedentary lifestyles, less places for public walking, etc.? I think we can spend hours on that. But the fact is that there is a drug out there, there is a cure out there, and we'll have to wait and see if this is something that can be a game changer. Thank you so much to all of you for joining us on the show this evening. We'll take a very short break right here on the India Development Debate, but stay tuned. A lot more coming up on the other side.